Thanks a lot for giving me an opportunity to talk here. This is my first time in AIOS and super excited. I'm a relative new face here. I will take a little bit time to introduce myself. I'm basically an optometrist. Then I went on to do a PhD in artificial intelligence at University of Melbourne. That's why this fake accent comes in. And after that, I came back to India to I joined at Remedio as a head of clinical research, and I involved in AI development tools. So there's a little bit of conflict of interest. I work for Remedio Innovation Solutions. Our company focuses on artificial intelligence enabled multimodal ophthalmic medical devices. Right. Now, what is AI? Well, AI is a set of computer algorithm that is able to perform tasks which normally requires a human intelligence, right? Now, for example, what you see there is a black box there. Now, we train that black box AI with something. Let's say in this case, we input a car, and the AI will tell you whether that input, whatever the image is, a car or not. Similarly, you can train to do a fundus photo. You send in the fundus photo, and the AI will tell you whether the fundus photo has any pathology or not, right? Now, most of this AI, this black box AI to be particular, are data-hungry networks, meaning it learns from its own data. It's self-learned, and it makes mistakes, it corrects itself, and then it gets more accurate. Now, AI, when I talk about AI is such a broad field. There is, of course, what I spoke is a deep learning AI, which is a machine learning. There is also NLP, natural language processing, where the ChatGPT comes in. How many of you uses ChatGPT here? None? Nobody? Smart ophthalmologist there. Right. So if you want to be a smart, please start using the AI technology. So natural language processing works on ChatGPTs. And then, of course, we have computer visions. And then there are AIs which are involved for robotics. Now, what I'm going to talk today is I will be focusing on the upper part where the machine learning techniques. Right. Now, I'm going to skip a couple of slides in the interest of time. Now, how this AI can be used in our ophthalmology? Well, AI can be used to detect anterior segment pathologies, right? It can be used to detect cataract, corneal pathologies like keratoconus, any conjunctival pathologies, dry eye, tear film abnormalities. Similarly, it can be used to check your posterior segment pathologies like diabetes, cataract, glaucoma, AMD, ROP, and so forth, right? Now, when we talk about AI, many ophthalmologists think that AI is a screening tool. You just send in some images, it's going to give me some output. Well, yes, it does some classification. So what you see here in this part is, of course, it does some disease classification, but AI is not just that, especially in ophthalmology field. It can do segmentations. For example, you send in an image, retinal image, it can automatically give you the vasculature. You send in the cornea image, we can automatically segment your corneal nerves, right? We can also stage you what disease this particular disease condition is. For example, you send us the image of diabetes, we can tell you what stage it is. Similarly, we can even use it for much longer or much complicated algorithms like finding out disease progression or finding out structure function relationships in glaucoma, right? Now, why we need AI? Now, when I told you, like, yes, this is all the use cases of AI, but today I'm going to talk about AI in ophthalmic screening, right? Now, AI in ophthalmic screening, why it is required? Now, if you look at it, in India, around 400 million people needs annual examination of eyes, but we have only 20,000 ophthalmologists, and most of you are here today, right? And you need to see at least 100 patients a day to complete these people, eye examinations, right? Now, most of the ophthalmologists today are trying to find out what is the problem, rather they must be spending the time on how I can give a specialized treatment and care, right? And most of the people nowadays are not aware about the chronic eye disease conditions, so they need to be identified and screened. So there is a care gap that is there, and which can be, bridged with using your AI. Now, how we can use this AI? So we can take a simple device, a non-mydriatic fundus camera like that, click photos of your fundus, run it on an offline AI algorithm which does not require any internet connections, and it is going to analyze the image and then say whether that image has glaucoma or not, as simple as like that, right? Now, we have evaluated some of the AI device technologies that we have developed. For example, this slide shows the AI developed for diabetic retinopathy, and we showed it has very good sensitivity and specificity in all different settings, in community eye screenings, in tertiary diabetic centers, in ophthalmic cares, in vision centers, and so forth. Similarly, we also gave these devices to primary healthcare workers in Kerala. These are nurses. We trained them how to click the photos and then run an AI. And using this, they were able to identify, the government of Kerala able to identify 2 districts which has higher prevalence of diabetes. So they can focus on those particular areas. So it has a public health perspective as well. We also have developed AIs for glaucoma, AMD, and ROP. The sensitivity and specificity of these is great. I'm going to talk one particular model there on here, where we gave these devices to the vision care specialists. So what they did was we gave this non-mydriatic camera to our vision care centers, that the technicians takes the images and then sends it to the AI, and the AI does a diagnosis of whether it is a glaucoma or not. Similarly, the images were transferred via cloud, and the teleophthalmologist sees these images and says whether they have glaucoma or not. Now remember, both of them saw only fundus images and made diagnosis whether they have glaucoma or not. Now, most of you will agree, glaucoma diagnosis need not to be done only on looking at the fundus images. You need visual field information and OCT to make a proper diagnosis, right? So what we did was, this is probably the most important slide I want to talk. We called back set of participants to the hospitals, and the expert ophthalmologist here looked at all the participants and then made a diagnosis based not just on the fundus images, but also based on the visual fields and OCT. Now, if you look at it, the number of false positive referrals just by the teleophthalmologist and AI is better. So the AI does a much better job. The number of false referrals reduces. Not just that, the number of false negatives also reduces with AI compared to the teleophthalmologist. So the most important question now. Okay, you showed this. Is AI is going to replace me? Is AI is going to replace ophthalmologists? Well, I say no. Why? Because right now what you do is AI is just helps you to aid in the diagnosis, aid in the prognosis. Okay, I'm almost done there. Now, ultimately, the treatment care and the surgery plans all in your hands, and I do not think the AI will replace ophthalmologists, right? So with that, I finished this with this quote here. Now, if AI can be developed with humility, discipline, and scientific rigor, ethics, and with respect to the data and regulations, keeping the patient as the most important stakeholders, the AI has the potential to impact millions. Thanks a lot.
Thank you so much. Yep. Do you see any downside of using AI in ophthalmology? Anything which could be a limitation?
Well, I will tell you what. So AI should be right now used as a tool which can aid you at the diagnosis, and I think that's where it should stop. Not should replace it, an ophthalmologist per se, but the downside is like just how any test is. It still has the sensitivity and specificity of 90%, so you can't push it. So it's like any other diagnostic tool. That's how you should treat it, and I think you should start embrace this technology because it's the right time. People are start using this AI in all different fields, and ophthalmology should start using this, and you should start using this as any other diagnostic tool.
I think for any AI platform to work, it's the machine learning and big data which is extremely important.
Yep.
Is the kind of information which is fed into it.
Yep.
And to ensure that the sanctity of the information which is fed into it is absolutely accurate, because it's going to predict subsequently.
Yep.
Is going to be a big challenge. You know, we ourselves vary so much on our diagnosis of diabetic retinopathy or angle measurement or disc cupping.
Absolutely.
So how to ensure that, you know, we say that this is predictive of glaucoma and this is not predictive of glaucoma, because 4 different ophthalmologists will differ in their diagnosis itself.
Right, right. So that particular slide, in fact, is done by 3 different teleophthalmologists, and then if 2 of them are in disagreement, the 3rd one came and they made a final decision. But to answer more about how do we train this AI, now I skipped a particular slide on that. Now the training of AI is based upon what data you feed it, right? So curating and sending out the correct data is more important. And also it has to be done ethically. Like I have to censor all the patient-related information. The AI should not learn about that, right? So the AI development part itself has to be make sure that the data curation for the AI has to be more ethically done and more accurately done for the AI to work. Yes, question. Right. All right, so the one I spoke about is a deep learning network. Now this deep learning network learns by itself, okay? The more the data is better. Now how much is the more is the question you are asking. That's, I can't put a number to it. So for example, the diabetic AI we used, we almost used like 1 million data to feed into it, right? So the more it is better it is. I'm talking now in the AI literature, there is something called overfitting of the AI model happens. So if you keep on feeding the data, they go on to overfit with this data, and then they start performing once when the new data comes in. But now, with the newer ways to deal with this AI, overfitting is not a problem now. Okay, we are seeing that even with the more data and more different ethnicity data, more different types of data, the AI is doing a much better job. Same with your chat GPT. It started, a few months ago, the chat GPT was not so accurate, and now it starts learning. Now, from the AI perspective, the AI scientists are not fearing now to overfit that data, right?
Thank you very much for enlightening us about the artificial intelligence. I hope just now, today, anyway, we are in trouble because when most of the patients of ours come with Google knowledge, and I hope they don't come with AI knowledge now to question us all the time, because as it is, all that knowledge is sometimes not very true, and all that's what they say is, all that Google gives us is not the truth. So it's my pleasure to have all the speakers with me today, and I think the two speakers have not come, Dr. Sonu Goel and Dr. Sandeep Reddy. Are they here? No. So I close the session today and thank the audience for being with us.